A child will often know that they are transgender from the moment that they have any ability to express themselves, and parents will often tell us this. We have parents who tell us that their kids, they knew from the minute they were born practically, and actions like refusing to get a haircut or standing to urinate, trying to stand to urinate, refusing to stand to urinate, trying on siblings' clothing, playing with the quote opposite gender toys, things like that. There is more and more a group of adolescents that we are seeing that really are coming to the realization that they might be trans or gender diverse a little bit later on in their life. So what we're seeing from them is that they always sort of knew something was maybe off and didn't have the understanding to know that they might be trans or have a different gender identity than the one they had been assigned. So that is a growing population that we are seeing, and that's being recognized as being trans and able to be treated.
The eligibility for getting gender-affirming surgeries at Boston Children's Hospital is basically the same as it would be for most other hospitals or surgeons in the United States. And that's the case because we all follow the World Professional Association for Transgender Health, or WPATH, standards of care. For top surgery, you are requested, but not required, to have been on gender-affirming hormones for at least a year. If you're a trans woman, it's really encouraged that you be on estrogen for at least a year because you want to maximize your natural breast growth. Many surgical centers require you to be 18. At Boston Children's Hospital, for top surgeries, we'll see people as young as age 15 if they've been affirmed in their gender for a long period of time and don't really have any other life complications that make surgery inappropriate. Looking forward to genital surgeries, and these we really start at age 18, age 17 for very few transgender women where it's really appropriate. You actually need a second letter from another behavioral health professional, and the purpose of that letter is to make certain that you understand the fertility implications about the surgery and you're really making an informed decision to eliminate your future fertility potential if you haven't already banked gametes or done other fertility preservation.
Gender-affirming hysterectomy is very similar to most hysterectomies that occur. A hysterectomy itself is the removal of the uterus, the cervix, which is the opening of the uterus, and the fallopian tubes, which are attached to the sides of the uterus. Some gender-affirming hysterectomies will also include the removal of the ovaries, but that's technically a separate procedure called a bilateral oophorectomy. And not every gender-affirming hysterectomy includes that, and people who are getting gender-affirming hysterectomies do not have to have their ovaries removed.
I am Helena. I'm 23 years old. When I was about 15, I started using Tumblr. I had an eating disorder since I was pretty young. There's a lot of messages that said, if you feel bad about your body, that means you're trans. I was just going through this period of like, I don't like how I'm treated as a cis person. I don't want to be cis because cis means you're uncool and you're privileged and you're an oppressor and you're bad, and I don't want to be that. In that way, I was really incentivized to try to figure out a way to make my voice heard in these communities. And obviously I can't change my race. I can't really change my sexuality. So the only thing left was to start playing around with the gender stuff. So I decided to call myself a demi-girl, which is one of the 40 million genders. And that basically means that I'm mostly a girl, but I'm a little bit not a girl, which is just like, what does that even mean? And then after that, I went to demi-boy. And then after that, I went to gender fluid. And after that, I eventually went to trans boy, but all this took like 2 or 3 years of just going through this repetitive cycle of changing this identity and changing it again, and it was just never enough. There was a lot of hopelessness for a long time, a lot of regret. The feeling of regret was intense.